There's limited information surrounding the COVID-19 vaccine and its effects on pregnant women. Health experts say frontline health workers are more likely to be exposed to COVID-19, and if they're pregnant, they're more likely to suffer from severe complications. Our Frankie Katafias spoke with one local doctor who received the COVID-19 vaccine during her third trimester.
I had the opportunity to get it when it very first arrived here in Boise, and it took me a few weeks to come to the conclusion that I wanted to receive it.
The CDC estimates that in the U.S., over 300,000 healthcare workers are pregnant or have recently given birth. At 7 months pregnant, Elizabeth Atnip, a doctor on the front lines of the coronavirus pandemic, had a lot to consider and a lot of questions about the COVID-19 vaccine.
Is this going to be dangerous for my pregnancy and dangerous for this baby? And I had to really dive into my own personal research.
Pregnant people were not allowed to partake in clinical trials for the vaccine. But according to the CDC, with the limited data on hand, they found no safety concerns in recent Moderna studies. This information, along with other studies, helped Dr. Atnip make a decision.
mRNA, for the most part, stays locally, which is why people are getting such a terrible sore, stiff arm. And then the mRNA is degraded really quickly in the body. So the theory is that if anything, there should be hardly anything that passes through the placenta other than my own antibodies.
Knowing the risks of the vaccine were much smaller than contracting the virus itself, Dr. Atnip got vaccinated.
The actual vaccine itself, I definitely got that sore, stiff arm for about 48 hours, I guess, after. And then maybe some fatigue and maybe some mild nausea. With pregnancy, it's really hard to tell what is, anything versus what could be pregnancy.
And despite the side effects, she's happy with her decision.
I would much rather not only have some small risks, but also potentially some huge benefits to myself and passing on some of that immunity to this baby, that it ended up feeling like a clear decision with some time and some thought put into it.
As a mother and medical professional, Dr. Atnip encourages anyone who's pregnant to consider getting vaccinated.
It was an emotional decision during pregnancy, but it absolutely ended up feeling like the right decision for both my own personal risk, and I'm hoping that it has benefits for my baby as well.
For Idaho News 6, I'm Frankie Katafias.